निकालना है।
May I come in, sir?
आइए।
Good afternoon, sir.
हाँ, कांवरिया साहब बैठिए।
Thank you, sir.
ये क्या कांवर से कोई नाता है क्या आपका? कांवरिया से कोई मतलब है कांवर से क्या?
No, sir. There is no relation with Kanwar, sir.
कांवर।
No, sir.
अच्छा। That's just your surname.
Yes, sir.
You come from Nagaur.
Yes, sir.
When was the first panchayat established in Nagaur?
Sir, on 2nd October 1959, first panchayat was established in Nagaur.
On the recommendation of?
Sir, on the recommendation of Sri Balwant Rai Mehta committee, sir.
And before this, Balwant Rai Mehta, what was the system that was working in India pre-1959? Nagaur के पहले क्या चल रहा था? You know about CDP?
Sorry, sir, I am not aware about this.
Community Development Program, do you not know? National Extension Services?
Sorry, sir, I am not aware about this.
All right. You come from Rajasthan, so let's start with your state. What is your status of literacy of Rajasthan?
Sir, in Rajasthan, literacy rate is 74%, and female literacy rate is 52% female literacy rate.
And how literacy is defined? Who is a literate person?
Sir, any person who can read or write is considered as literate.
What should be, at what age?
Sir, more than 7 years of age.
More than 7 years of age.
Yes.
Okay. All right. Why the Great Indian Bustard is disappearing from Jaisalmer?
So there are multiple reasons. One is loss of their habitat. Then other is they stuck in the wiring of electrical lines. Then one reason is poaching also been done.
Have you been to Jaisalmer?
No, sir.
You have not visited Jaisalmer.
No, sir.
Which desert part of Rajasthan you have gone to? Have you gone to any place called Barmer or Jodhpur or?
Sir, I have been to Jodhpur.
Jodhpur.
Yes, sir.
Do you have any idea how the desert was created in Rajasthan? What was the phenomenon? पहले क्या था वहाँ? How the desert has come out?
Sorry, sir, I am not aware.
You are a medical doctor.
Yes, sir.
And you have practiced medicine also as a doctor.
Yes, sir.
So, you practice what? Internal medicine or what? Which area? Or general?
Sir, general medicine. I work as a senior resident doctor at Girdhari Lal Maternity Hospital in New Delhi, sir.
What is AMR?
Sir, antimicrobial resistance is the mechanism in which the microorganism like bacteria, virus, which got a resistance against the antibiotics, and the antibiotics become less effective on their microorganism.
Which part of the brain controls the limbs? हाथ पैर का movement कहाँ से control होता है सारा?
Sir, internal capsule control these movements, sir.
Capsule?
Internal capsule, part of the midbrain. It is.
Is that called cortex?
Sir, it is part of cerebral cortex in which specifically midbrain part which control the limb movements, sir.
In that context, have you heard about good news, breaking news that Neuralink has developed a chip that will work in the cortex region and make people who are disabled by limb movement?
Yes, sir, I heard about it, but I do not know the exact details about it,
It's
sir.
a revolutionary thing in medicine.
Yes, sir.
All right. Have you read about latest developments on cancer front? What is happening to control cancer?
Yes, sir. Recently, in budget, government announced the vaccine for cervical cancer to the age group of 9 to 14 year
What
old.
is the name of that vaccine?
So there are two vaccines for the cervical cancer. One is Cervarix, then other is Gardasil vaccine, sir.
What do you know about HPV vaccine?
Sir, these are HPV vaccine. These are made against the human papilloma virus. It is one of the major cause of cervical cancer. So, if it is taken before the age of sexual intercourse, it will reduce the chances of cervical cancer by around 90%.
Okay. Which age group, see, cervical cancer is more endemic to women,
Yes.
right?
Yes.
Which age group of women are more vulnerable to cervical cancer? It's all age group or there is some particular age group?
Sir, usually after 40 years of age, it is more common in females, sir.
After 14 years?
40 years, sir.
40 years?
Yes, sir.
40.
Yes.
What is the main health burden of Rajasthan? Which disease is most prevalent that needs to be tackled?
Sir, currently there is increasing incidences of lifestyle diseases like diabetes, hypertension, heart diseases like myocardial infarction, then continuous burden of communicable diseases like tuberculosis. Then, sir, there is a higher incidence of occupational diseases like silicosis, and the recent emergence of mental health issues is also prevalent, sir.
What is the status of health infrastructure in the state? Poor, good, or excellent?
Sir, it is good in Rajasthan.
How good?
Sir, currently Rajasthan government, sir, 2 years back Rajasthan government come with the Mukhyamantri Chiranjeevi Swasthya Bima Yojana, which cover up to 25 lakh insurance per year per family. Then for government employees, there is a scheme, RGHS scheme, which is on the similar line of CGHS. Then for promoting doctors at the primary healthcare centers, there is a scheme for giving reservation to them in post graduation. So there are sufficient doctors at the PHC level.
All right, fine.
Sir.
What do you know about the exit system of examination that has been introduced in the medical education?
Sir, NMC come with the exit exam, which will be common exam for all the students in the country. It is also called licentiate exam. After the passing with this exam, only a person can practice the medicine. So it will bring uniformity in the standards of medical education.
Fair enough.
So as a doctor, you have done something that you are a registrar in geriatrics department OPD. What does it mean? Registrar means what? You are only registering or doing something more?
No, sir. In the medical field, registrar being a senior doctor, which manage the function of the either medical unit or OPD by coordinating between the staff and junior doctors and ensuring that there are availability of resources.
No, so registrar means what? What is the function?
Sir, as a registrar, my function was that I used to inform the higher, like a unit in charge of geriatric OPD, along with the monitoring that all the functions.
Inform what?
About the condition of patients or about the availability of resources there, any grievances of the patients and all those.
So it is a part of the job, isn't it? So part of the job you have put it as your special achievement. Is it fair?
Sir, it was a different experience.
True, but it is still a part of the job, isn't it?
No, sir. Actually, sir, in BJ Medical College Ahmedabad, there was only one unit was assigned as a geriatric OPD. It was not for all. So this was a different experience from the normal practice of general medicine, sir.
But everybody has some kind of a special experience.
Yes,
Is it or is it not?
Yes, sir.
So every special achievement experience doesn't become a special achievement. Anyway, now second thing you tell me that what is this endurance running? Is it the same thing as marathon running or something else?
Sir, marathon running is also a type of endurance running. Endurance running called when one person continuously run for more than the 3 kilometers, sir.
Now time has something to do with this or not? But only the distance or even time? Because naturally, if you can run 3 kilometers say in X seconds, then if you can do it in X by 2 seconds, is it still an endurance running, or will it be called something else?
Sir, for running, speed should be more than 9.6 kilometer per hour. That's it.
What is the maximum speed a man can run?
Sir, I don't know exactly.
You know the world record. You must be knowing some
Yes,
world
sir, yes,
record.
sir.
So from there you can calculate.
Sir, in the full marathon, world record is of 2 hour and 38 second. And in a half marathon, it is 52 minutes, sir.
So what is the speed?
Sir,
Maximum
it
speed.
is approximately, sir, around 19 kilometer per hour, sir.
Okay. You know, actually, if you are in the administrative job, sometimes you have to do with even the medical services.
Yes.
Now, for people, even people under insurance of some kind or CGHS, now they find that this cashless treatment is still not a very comfortable situation. Why?
Sorry, sir. Can you
Cashless
please
treatment, that means you have some kind of entitlement.
Yes.
You have a card or whatever.
Yes.
Now you go there and they say, okay, you go to the hospital and you are covered and you don't have to pay cash.
Yes, sir.
They will take care and send the bill to the department. Now, but the reports, as far as I am aware, is that this system is not working very well. The patients get difficulties, the hospitals are not satisfied. Why?
Sir, one reason behind is that insurance companies they try to get maximum profit for themselves, so they find the minute reason for the cancellation of that disbursement of amount to the hospitals.
Yeah, it's not very clear.
And second, sir, in CGHS there is no cashless scheme. There is no cashless scheme in the CGHS. First we have to pay the amount, then that will get reimbursed, sir.
No, what about pensioners? Pensioners, I don't think I have to pay cash.
Sorry, sir, I am not aware about this. I
You're
will
not
go
aware
back and read.
Okay, doesn't matter. Now let's go to some totally different area. Now it is all voting election season
Yes, sir.
all the time. Or some time or the other, some elections are coming within 6 months or so. Now there was a proposal that you should synchronize the elections. Now what is your view on that? And there is a opposite view also. So what is your view and whether it can be implemented or should be implemented?
Sir, in my opinion, simultaneous election can be implemented.
Not
It will-
selection. We are talking about election. You said simultaneous election.
Yes, sir. Sorry.
Simultaneous election.
Election
Yes.
can be implemented. It will bring policy certainty, and it will reduce the policy paralysis, and expenditure which occur during the election will also get reduced. Then the diversion of other resources like teachers doing the duty in election, this will also get reduced, and it will benefit the students. Other view is also that it can affect the federal structure of our country.
How?
Sir, federal issues can get reduced in the simultaneous election. But
How? Explain it further.
Sir,
Give some example.
sir, like during the simultaneous election, people can vote for the same party in the Lok Sabha election and state election. But during the last general election in 2019, we can say that in Odisha and Telangana, there was a different government than the center. So simultaneous election can be beneficial for us and should be implemented, in my opinion, sir.
Then why there is so much of opposition? You also made some points, but is there such a serious reason not to go for it? What is the serious reason? Okay, an allied question in this area itself. Now, what about right to recall? You have heard about it?
Yes, sir.
So, what is your opinion on that?
Sir, at present we does not have this provision in Lok Sabha and State Assembly. But at local level, in some states, there is the provision of right to recall, like in Haryana. If a constituent of the constituency feel that the representative of there is not doing as per their demand, so they can recall that candidate, sir.
We can recall that candidate. What is the procedure?
Sir, I am not aware about the exact provisions of the
Okay.
process.
Your hobbies, of course, you have written as walkathon, isn't it?
Yes, sir.
Walkathon or endurance walking. Now, it helps which part of the body most? Only the legs or something else? Lower limbs or something else?
Sir, it is a type of aerobic exercise, so it will help overall the body. It also help the heart, and it help in mood elevating and reducing the stress. Sir,
What is your view on homeopathy as a system?
Sir, homeopathy is based on the principle that like is cured by like. The something which cause disease is given in the lesser amount, so it get recovered from the disease. It is beneficial in some diseases like allergic diseases, and also helpful in some chronic diseases. So there should be evidence-based research and proper regulation of that.
So, as a professional,
Yes, sir.
you are not opposed to the homeopathic system because many of the allopaths they totally debunk the homeopathic system. They said it is quackery. What do you say?
No, sir, in my opinion, it is not quackery, but there should be more research on this, and there should be regulation. So, trust
Okay,
in-
last question. Give a crisp answer. Where do you see yourself after 15 years?
Sir, in professional life, I will try to do my best.
It's a very general thing. I said crisp,
Yes, sir.
specific.
Sir, in professional life, I would say
From what are you now? Where will you reach in the next 15 years?
Sir, currently I am trying to get into the Indian Administrative Services. So I will see myself in the service, serving the society. And in personal life, I want to spend the quality time with my family.
Family? No,
and,
that's all right.
at-
Family is okay. Okay, fine.
You will be aware of the national health policy.
Yes, sir.
So, is there any link between the health policy and the population policy?
Sir, there are few common targets in national health policy and population policy, like reducing total fertility rate, then the reducing the infant mortality rate.
So, have we reached the replacement level?
Yes, sir, we already, according to National Family Health Survey data of fifth, we already reached the TFR level of 2.0, sir.
So, but then why is the population still increasing and then it is not stabilizing?
Sir, it will stabilize by in coming years, but we reached the replacement level at present, sir.
So, is there any target set for that? By what time the stabilization will be reached?
Sorry, sir, I am not aware about this.
Now, can health be made a fundamental right, like right to food or right to education?
Yes, sir, it is desirable to make the health as a fundamental right, but at present we does not have enough sufficient resources for that. So rather than making it fundamental right, we can make that insurance based model like Ayushman Bharat is covering 40% of poor people. And
So,
just
did you have any experience with implementation of Ayushman Bharat?
sir, personally I does not have any experience.
While working in the hospitals, you never came across any such patients? Or...
No, sir. At the time I was doing post graduation, this scheme was not into the implementation.
Is there a regulator for the health sector in the country?
Yes, sir. National Medical Council is for regulating the medical sector.
So is it an independent body? What is its composition?
Sir, National Medical Council composed of sir, 60% of doctors are in this, and the other 40% are from other sectors. Then there are 4 autonomous board under this for undergraduate education, postgraduate, then medical ethics and rating, and
Okay, no, fine. So is it able to resolve issues like what sir referred to, the problems in cashless treatment or problems regarding insurance? Is it its mandate to look into such issues?
no, sir. Regarding insurance, NMC does not have any mandate. They regulate the medical education and medical establishment only, sir.
So there is a lot of concern about low public expenditure on health.
Yes, sir.
So is there any ideal limit prescribed for that?
Sir, National Health Policy 2017 recommended to increase the level of expenditure on health to the 2.5%, sir, from 1.4 to 2.5.
And what is the ideal prescription? How much should it be?
Sorry, sir, I'm not aware.
So is just the spending part of it sufficient to have the outcomes?
Sir, by increasing the health expenditure to 2.5, it will reduce the out-of-pocket expenditure by around 30% as per National Health Policy, sir.
So what is needed to step up the efficiency of that? Just the spending is sufficient?
Sir, along with the spending on the healthcare, we also need to take steps like promoting cleanliness, hygiene, and improving on the vaccination part in preventive healthcare, sir.
And lastly, as a person from the medical background and having working for the income tax department, what would be your diagnosis in one prescription to get out of our ills, say in the financial field?
Sorry, sir.
For the
can you
health
please-
sector,
Yes, sir.
like government is giving a lot of production linked incentives.
Yes, sir.
So like FDI in the pharmaceutical sector. So are you aware what type of incentives are being provided?
Sir, recently government come up with a PLI scheme for making the bulk drug park in India. And then other scheme is for manufacturing of medical devices in India, and also promoting the manufacturing of API in our country, sir.
Thank you.
Yes.
See, you were a doctor
Yes.
and you are in IAS.
Yes, sir.
Let me accuse you of you look brilliant, so very intelligent person. So intelligent person of India getting trained in doctor and then getting trained in IAS. You are taking a lot of national resources. And then you want to join the Indian Administrative Service. So, I mean, how do you counter this charge?
Sir, I accept the fact that a lot of public money was spent on me, but I see this public money as an investment on me. By coming into the civil services, I will serve the society, though in different platform and different capacity, sir.
You have mentioned NHFS 5
Yes.
survey. Tell me the highlight of that. What does it say about our health status of common people in India?
Sir,
First thing, is the result available state-wise, district-wise?
yes, sir, state-wise, sir.
Not district-wise?
Sir, not aware about district-wise.
What is the highlight of that?
Sir, according to NFHS 5, we achieved the total fertility rate of 2.0. Then, in field of malnutrition, there are reduced the incidences of stunting and wasting, but anemia increased by 10% from 57 to 67%. Then institutional delivery get increased 8% at 90% of institutional delivery happening. Then
So, we
Yes, sir.
have Anemia Mukt Bharat Abhiyan,
yes, sir.
and NHFS 5 says that 51% of the women are anemic.
Yes, sir.
You are district-wise state. What would be your conversation with CMO, Chief Medical Officer, to reduce anemia?
In women specifically.
In the district, yes.
Yes, sir.
What is it that you will review and what is it that you will advise?
Sir, first I will I will collect the data, and then according to the data, the mapping should be done where we need to focus more at immediately. Then regular like pregnant women are more vulnerable for the anemia, so regular ANC checkup should be ensured. Then their nutrition awareness should be raised, and sufficient nutrition should be provided to the pregnant women, like bajra and the jaggery. They are iron rich food, along with treatments. Like some patient, if they have anemia, there is timely treatment should be done.
So some of the experts say that India has put the infrastructure in place. You agree with that? In health, have we improved our infrastructure at the ground level in last 5 to 10 years?
Sir, after COVID pandemic, there is lot of improvement in the infrastructure at primary and tertiary level. Then there are healthcare manpower also increased in last 10 years. Like in seats in MBBS almost doubled in last 10 years, and postgraduate seats are also increased. And in Ayushman Bharat, there is a health and wellness center. There 1.5 lakhs health and wellness center are at present functional. Then focus of health and wellness center has also increased from maternal to child health care. There is inclusion of non-communicable diseases, mental health, then emergency services at PHC levels.
And India faces a problem of way less number of doctors compared to the population that we have. So, if you are a health ministry, government of India, what will you do to make the life of doctor more attractive?
Sir, at present we have a ratio of 1 to 1200 doctors per population, and according to WHO recommended is 1 to 1000. And sir, as per Niti Aayog report, we will achieve this in 2024. And to make the life of doctors attractive, we can provide them incentives to serve in the rural area, like Rajasthan government is doing, and recently Andhra Pradesh government is also come up with the differential package to serve in the rural area, urban area, and tribal areas.
So, have you heard of a term called behavioralism? And especially it is applicable in many of these sectors, social sectors. What do you understand by this? Person got Nobel Prize in this, in one of the economics. So behavioralism and the application of behavioralism for the improvement in the impact of the health system.
Sir, behavioralism focus on impacting the focus on behavior of the population. Just like during the Swachh Bharat mission, the behavior of population was linked with the cleanliness. That if the people keep clean their houses, they will be healthy.
Okay, thank you.
I haven't seen your hobbies. What kind of hobbies you keep?
Sir, I do the endurance running.
Okay, you have also in endurance running.
Yes.
That's only hobby?
Yes, sir.
All right. Do you read current affairs?
Yes.
Day-to-day basis?
Yes, sir.
You have any idea what is happening in the Middle East, that is West Asia, in the last 2-3 days? Have you read newspaper yesterday, day before yesterday? Today?
Yes, sir. Sir, last 2-3 days.
US has bombed some countries in Middle East. Any idea? It has bombed Iraq and Syria.
Yes, sir.
Why?
Sir, there was a killing of 2 US soldiers a few days back. So, in retaliation.
So, US is against Iraq or US is against something else? US is directly attacking Iraq or is attacking somewhere else? In
No,
Iraq?
sir. It is not directly attacking the Iraq. It is attacking their uh, terrorist group there and radicalist group also present in the territory of Iraq. So
What is the terrorist group? Who is
That-
supporting the terrorist group?
I am not
You do not know
Exactly.
much. You do not know much about international affairs. All right.
yes.
Okay. Coming to political affairs in India, what do you think can be done to have better electoral governance in the country? Some reforms are required. The electoral administration,
Yes, sir.
or everything is fine with the elections.
Sir, some reform which can be implemented for electoral reform, like one is simultaneous election, other the funding.
So you approve simultaneous elections. You are in favor of simultaneous elections.
Yes, sir.
Okay. You think it can ever be done? Is it practical?
Sir, it was the norm till 1967.
That was another time.
Yes,
Today
sir.
the time is different.
Sir, it can be possible in current scenario also, sir.
Okay, so one is electoral simultaneous. Then what?
Then, sir, transparency in the electoral funding.
Hmm. Okay.
Then, preventing the
Criminalization.
criminalization of politics.
Hmm. What is the state of affairs in Rajasthan? What percentage of criminals are there in legislature? Every state you have a high number of criminals. Is there any data? Are there criminals, background people, MLAs there in Rajasthan?
Yes, sir. But I am not aware about the exact data of that. I will go back and read about this.
All right. Thank you.
Thank you, sir.
So, why is today's date significant from the health point of view?
Yes, sir. I have the allergic bronchitis. So yesterday I came.
I'm saying why is
Today is something
February,
important.
February 4th, why is it important from the health point of view?
Yes.
Is there any significance of February 4th?
Sorry, sir. I am.
ठीक है ठीक Thank you.
You can go.
Yes. Thank you, sir.
बेस्ट वही है आइए
Let me start. I will take
आप
my
ये
own observation.
जरूर
So,
you can.
see, you have a lot of strength that you are already in from one profession, you are in IAS, and that's why you are facing the interview. The confidence should reflect on your thing. It is not reflecting to that.
Yes, sir.
For a normal officer who is already an officer of IAS, the body language and the speaking, your speaking, you have to slightly look at it, put slightly more energy into it. Your energy looks like a dipping down in after one sentence and two sentences. So put more energy in. This is not a time to garner much knowledge. And at least 20% or 30% of the UPSC question interview will be there where you have no clue. So you are aware, it is fine to say that, sir, I have not heard about it or I have not known. There is nothing wrong in that particularly, because that will prompt a member to ask you different questions which you know. So you already expect a lot of questions from your both the professors earlier.
Yes.
And please remember that health and the public health system are great focus area for anybody to ask. So there will be a lot of questions from there. Many of your questions are very short. They are correct, but they are not elaborated. So you have to kind of, what you have to do in terms of preparation, whenever the interview, right now you think that on health, on public health, people can ask me these questions. There are many questions which as an administrator you would like to know from you or from any intent, and it's a general awareness in terms of health. So health and family welfare system, the present initiative of the government, the problem that India has in terms of health, the problem of the recruitment within health. There are many systems which is health within health itself is always there. It's not just that they will ask only from health, they will ask from Rajasthan, from many other places, but on health. Now your answers look as if you are kind of recalling in the interview board, interview time, that what is it, and then you try to apply. It looks that you are unprepared for these questions, whereas you have the knowledge.
Yeah.
So it is very important that you look at around 5, 10 or 15 or 20 or 25, 35 questions that you think about it, and then think that suppose somebody asks me a question, there is a template. If somebody asks a question, you have a correct answer on many things. I would like to first try and understand that what is the problem that is there, and then try to see that what are the instruments available for handling those problems, and then try to see that why it is not happening, and then try to see how it is improved. And some of the new things, modern things with the present government or which is country at present is looking at is the use of digitalization, use of new technology and all this thing to handle the health and all this thing, and reaching every person. The concept of behavioralism in health. These are something very important. Please read up about that. These are very important. But your basic thing is that you have knowledge and you have advantage of being into service to this thing. You have still not got it to the level of using this as an advantage. So what you are trying to do right now is that you're speaking from your storehouse of knowledge, which is there. Try reconfigure it by thinking of many questions and then try reconfigure it. Otherwise, it will be pretty nice. But then the questions are very, very. You don't turn the question into opportunity. When a UPSC member asks a question or something, you turn it into opportunity to showcase it, without speaking much. Right?
Kitna, what was your score in the last interview?
Sir, 2 time 151 and last time 146, sir.
See, what was the score?
151 and 145.
2 interviews.
45 or 46. Yes.
That's because you are not able to change some fundamentals in your personality, let me tell you. Even now it's difficult. See, articulation level is average because you come from Rajasthani Hindi belt, and
So
also
my-
that you are also a doctor also, so you did not get that exposure to English.
My 3 interviewer in Hindi only. This
So, इस
time
बार
first time English.
तो why हिंदी में ही
इस बार हिंदी में से इंग्लिश में क्यों टर्न किए, क्या फायदा उससे हो रहा है?
So I was not getting the marks, that's why.
नहीं, तो इंग्लिश में कैसे लगता है? क्या
All people tell that they expect from you in English. You are qualified to MD doctor and you are in the IAS side now.
गलत बात। देखो उसी में इंटरव्यू दो तो हिंदी अच्छे से बोलते हो अंग्रेजी की अपेक्षा,
Yes, sir.
तो गलत बहुत बड़ा गलती की हो। अभी भी तुम हिंदी में दो इंटरव्यू, क्योंकि वो हम कहने वाले थे अभी आपको कि अभी हम एक्सप्लेन ही कर रहे थे आपको कि आपका मेडिकल बैकग्राउंड, राजस्थान का बैकग्राउंड आपको अच्छी अंग्रेजी बोलने से मना करता है, जो कि नेचुरल है बहुत ज़्यादा। और उसके चलते आप जैसा सर बता रहे थे, आपको आपके आंसर्स एडिक्वेट नहीं हो पा रहे हैं, आप किसी चीज में एक लाइन बोल के छोड़ दे रहे हैं। दैट्स नॉट अ कंप्लीट एक्सप्लेनेशन। हम पूरा सुनना चाह रहे हैं उसके बारे में, क्या कहना चाहते हैं। तो हिंदी में अगर आपको लगता है कि आपका धारा प्रवाह है तो हिंदी में ही जाइए। मात्र अंग्रेजी में शिफ्ट करने से खुश होकर आपको 180 नंबर नहीं देगा, हो सकता है 10 नंबर और काट ले, क्योंकि आप बोल ही नहीं पाएंगे।
Yes.
तो ये इस चीज़ को आपको चिंता करने की ज़रूरत है, मनन करने की ज़रूरत है। हिंदी में भी लड़के 180-90 नंबर ले आते हैं, अच्छा करते हैं। मैं पर्सनली सुझाव दूंगा कि हिंदी में ही आप रखिए। मीडियम के चलते आपको कम मार्क्स आ रहा, वो नहीं है रीजन। और अंग्रेजी बहुत अच्छी रहती तो आपसे स्विच करते,
Yes, sir.
तो बहुत बेहतर। तो आप पढ़ नहीं रहे कहीं, इंग्लिश भी आपके लिए चैलेंजिंग है, आप बोलते
Yes,
हैं
sir.
लेकिन आप स्ट्रगल करके बोल रहे हैं ना।
Yes.
डोंट डू दैट। हिंदी में बोल सकते हैं इंटरव्यू में अभी भी।
Yeah.
तो लोग क्या कह रहे हैं कि हिंदी से इंग्लिश कर लो, लोग को भूल जाइए आप। जो धरातल पे सच है उसको देखिए आप हिंदी में दीजिए। और सीधा रीजन है कि आप राजस्थान के प्योर हिंदी बेल्ट से आप आते हैं।
ये किसने कहा भाई, राष्ट्रपति प्रधानमंत्री सब हिंदी में बोल रहे हैं, किसने कहा कि अंग्रेजी
हिंदी बोलना गुनाह नहीं है भाई।
या आपको इंग्लिश बोलने से नंबर, आपको
सरकार में आने में आजकल सभी को हिंदी बोलना पड़ रहा है, सबको हिंदी।
कोई कारण नहीं कि आपको अंग्रेजी में शिफ्ट करना चाहिए। देयर नो रीजन हिंदी में आप हिंदी से, वही सबसे बड़ी बात आपने गलती कर दी है। दूसरा ये है कि सर ने कहा आप मेडिकल डॉक्टर भी हैं, IRS में हैं, यू हैव एवरी रीजन टू बी प्राउड ऑफ योरसेल्फ एंड कॉन्फिडेंट अबाउट योरसेल्फ। लेकिन वो कॉन्फिडेंस आपके बॉडी लैंग्वेज से आ नहीं रहा है। आप एक लगता है कि बिल्कुल अभी भी थोड़ा हल्का सा डरे हुए हैं, हल्का सा नर्वस हैं। वो चित्रण आता है जब आपका इंटरव्यू होता है। तो क्यों होना चाहिए? यू आर वेरी सॉलिड कैंडिडेट। उस सॉलिड कैंडिडेट को चेहरे में भाव भंगिमा भी आना दीजिए ना। आप कम किससे हैं? IRS आप पा चुके हैं, आप डॉक्टर हैं, यू शुड बी वेरी वेरी कॉन्फिडेंट। वो चीज़ नहीं आ रहा है इससे, तो उसको थोड़ा सा लाने की कोशिश की। हिंदी में इंटरव्यू दीजिए और जो क्षेत्र है जहाँ से सवाल पूछा जाएगा बिल्कुल क्लियर है आपका। IRS पे बिल्कुल घमासान सवाल होगा, एक एक चीज़ आपको जानना चाहिए। IRS का जितना भी पहलू है सारा चीज़। जनरल भी टैक्सेशन के बारे में जानना चाहिए। आप तो डायरेक्ट टैक्सेस में है, इनडायरेक्ट टैक्स को भी जानना चाहिए, क्या स्ट्रक्चर है टैक्स का वगैरह वगैरह। राजस्थान पे भी 4 इशूज हैं राजस्थान में। चूँकि डॉक्टर है तो आपसे राजस्थान का हेल्थ इशू पूछा जाएगा, बाकी चीज़ें पूछा जाएगा। क्या वहाँ पे इश्यूज हैं मेजर, क्या किया जा रहा है वहाँ पे, वो पूछा जाएगा। और IRS से IAS में शिफ्ट क्यों करना चाहते हैं, ये तो पक्का ही सवाल आएगा, क्योंकि आपने एक ही इसमें ऑप्शन दिया IAS, और कोई ऑप्शन आपने नहीं दिया है। यू डोंट वांट इवन IPS और IFS।
IPS के लिए तो एलिजिबल नहीं, हाइट कम,
एलिजिबल नहीं है, अच्छा हाइट कम है, और IFS में आपको दिलचस्पी नहीं है।
यस
हाँ, तो उसको बेहतर ढंग से बना के बोलना पड़ेगा, ओनली वन चॉइस आपने दिया है,
यस
ठीक है। IAS के अलावा कोई ऐसे ही पूछेगा मेंबर कि इसका मतलब कि IRS को आप उससे IPS और IFS से ज़्यादा ऊपर रखते हैं क्या, तो आपको जवाब देना पड़ेगा उसको, ये क्वेश्चन आ सकता है आपको।
यस
इस पे तैयारी कीजिए, आप हिंदी में बोलिए, और थोड़ा पर्सनालिटी में विकास कीजिए। विकास का मतलब ये होता है कि एनर्जी और कॉन्फिडेंस होना चाहिए। आप अपने को बेच रहे हैं इंटरव्यू बोर्ड के सामने, तो बेचने के पहले आदमी कारवार को कर लेता है ना पॉलिशिंग, तो पॉलिशिंग कीजिए उसको अपने को सीधे।
फिर ये हिंदी में नहीं बोलने के लिए किसने सुझाव दिया, कोई इस तरह मॉक इंटरव्यू वालों ने या किसने, या आपके सहयोगियों ने, किसने कहा?
कलीग्स नहीं था।
नहीं, कलीग्स को कितना गलत बोल रहे हैं कलीग्स। इंग्लिश में कौन बढ़िया आप कर पा रहे हैं, परफॉर्म नहीं कर पा रहे हैं। हिंदी में आप शायद ज्यादा बेहतर जवाब दे पाते हैं,
यस
शब्द आते हैं आपके पास हमेशा। आप इसमें भी तो हल्का सा संघर्ष करके बात कर रहे हैं ना हमारे
Yes.
साथ। यू आर नॉट वेरी फ्लुएंट इन इंग्लिश, व्हाई शुड यू स्विच ओवर टू इंग्लिश? इट विल नॉट गिव यू एनी एडवांटेज। इंग्लिश में आप बोल के बढ़िया नंबर ले आएंगे। रीजन वो नहीं रहा होगा जो आप कह रहे हैं कि हिंदी में दिया तो कम नंबर,
वो तो
रीजन पर्सनालिटी का पार्ट रहा है। जो पर्सनालिटी आप सामने लेके बैठे हो वो पर्सनालिटी का पार्ट है। यू आर नॉट एबल टू गिव अस ए वेरी डायनामिक पर्सनालिटी, लेट मी टेल यू वेरी वेरी फ्रैंकली, वो रीजन रहा है। उसमें वर्क यू कैन, व्हाई यू हैव एवरीथिंग, you have everything to claim a better mark, okay? उसको क्लेम कीजिए, आप दावा कीजिए आप उसको। वो रीजन नहीं रहा इंग्लिश, हिंदी इंग्लिश, पर्सनालिटी प्रोजेक्शन का रीजन रहा आपका, समझ रहे हैं आप?
यस
ठीक,
सारे पॉइंट अच्छी तरह से समझा दिए गए आपको। और एक छोटी सी बात की थी, ये मत भूलिएगा कि ये पर्सनालिटी टेस्ट ही है, नॉलेज टेस्ट नहीं है। और पर्सनालिटी प्रोजेक्शन ये भी पॉइंट आ चुका है कि आप अपने आप को सेल कर रहे हैं। तो और एक चीज़ मत भूलिए, यू आर ऑलरेडी इन ए वेरी गुड सर्विस। तो इस सर्विस से आपको सो कॉल्ड और ऊपर अगर जाना है तो कुछ तो प्लस होना पड़ेगा, तो वो आपको वो प्लस भी क्रिएट करना पड़ेगा। और वो अब अभी क्या है कि कंट्रडिक्शन हो रहा है। आपने तो कहा मैराथन रनर ये वो, और एनर्जी आपकी एकदम लो, तो इट इज अ कंट्रडिक्शन। ये समझ में नहीं आता है ऐसा क्यों हो रहा है। हाँ, तो एनर्जी तो कम से कम प्रोजेक्ट करिए,
दिख नहीं रहा बॉडी से,
एनर्जी प्रोजेक्ट नहीं करेगी,
वाइब्रेशन आना चाहिए।
ठीक है।
When I gave the first interview, I got average marks.
हिंदी में बोलिए, हिंदी में।
सेम बोर्ड में जो बड़ा खुखार बोर्ड माना जाता था, दूसरे बार में वही पड़ गया, लेकिन पहले बोर्ड में पहली बार में IPS ऑफिसर बन गया। तो जब सेकेंड बार दिया तो आई एम वन ऑफ द हाईएस्ट पर्सन दैट बोर्ड। द ओनली डिफरेंस दैट आई हैड वाज कि हमारी कॉन्फिडेंस बहुत ज़्यादा थी कि अब तो IPS आ ही गया, अब इसके बाद तो थोड़ा सा इससे और ऊपर अगर पहुंचना है तो IAS लाना है, आ गया तो आ गया, नहीं आया तो नहीं आया, IPS तो नहीं। आपके साथ भी वही है, वायरस।
You have nothing to lose, ये समझ लीजिए ना।
All that you do is so both are a friendly this thing.
Not yet.
An officer,
नहीं आ रहे उनसे कोई जॉब मांगने के लिए,
आप रिकॉर्ड ह्यूमन बीइंग नहीं हो, जबकि जिसमें ना आप तो ऐसे ही, इसीलिए आपसे एक्सपेक्टेशन ज्यादा होगा। वो देखिएगा इंटरव्यू हम कैसे देखते हैं, बैकग्राउंड देखते हैं, फिर सोचते हैं कि क्या है, अच्छा ऑलरेडी IRS, अच्छा थोड़ा लेवल बढ़ा दो।
आपसे ज्यादा अपेक्षाएं ज्यादा
अपेक्षा भी आपसे ज्यादा होती है, इससे थोड़ा कॉन्फिडेंस लो। हिंदी बोलो, अंग्रेजी बोलो, जो करते हैं बोलो, और क्वेश्चन के बारे में सोच लो पहले कि इसमें क्या क्या बोलो।
प्रैक्टिस करो काफी। ये सब बोला जाएगा मैं स्टैंड लूंगा, क्यों लूंगा ये स्टैंड, अपने से वार्तालाप करो। दूसरों से सीखने के बदले अपने आप में सीखो, अपने को फोकस करो। क्या बोलोगे, चार लोग क्या करें, कलीग्स क्या बोल रहे हैं, चार मॉक वाले क्या करें, कुछ काम नहीं आएगा आपको। वर्क ऑन योरसेल्फ, ओके, थैंक यू
सर। मॉक और ज़्यादा देना चाहिए मुझे कि सेल्फ प्रैक्टिस ज़्यादा करना चाहिए?
सेल्फ प्रैक्टिस ज्यादा करना चाहिए। मॉक का कोई मीनिंग नहीं है। 1000 इनपुट मिल जाएगा, गलत सही, कोई चश्मा बता देगा उल्टा है, कोई बोलेगा टाइट टेढ़ा बना हुआ है, कोई बोलेगा बैठ नहीं ठीक है, एकदम बर्बाद हो जाओगे उसमें। डोंट डू दैट। जो देना था इनपुट हम दे चुके हैं आपको। वर्क ऑन योरसेल्फ, डोंट गेट एक्स्ट्रा।
ये डिसाइड कर लो किस हिंदी में देना, इंग्लिश में देना, बी फर्म ऑन दैट। उसके बाद इन लाइंस पे तैयारी करते रहिए।
Yes.
10
जानकारी आपको सारी है, जानकारी की जरूरत नहीं है, ये प्रोजेक्शन की बात है, वो देखिएगी।
जब पता चल गया हमें कहाँ इंप्रूव करना है तो क्या करना है, मौके दे के कहीं कोई गलत सही भी बता सकता है। उन सब चीजों में मत पड़ो।
ठीक है, ऑल द बेस्ट।
थैंक यू।